balance this, we'll take this. Okay. All right. So here's my patient assessment. So we got, bear with me, I'm a little sick. So we got to make sure the scene is secure and safe first. We take a look around. Yep, all safe. Yep. All right. We can check if they're breathing. We want to check their breathing first. We check it. Yep. Okay. So we're in our windshield phase right now. So we're gonna check their neck, see if their neck's okay. In this case, they're unconscious. So I'm gonna say that they're unconscious. So we're gonna try to find a way to get them back breathing, whether that's with an AED or that's CPR. Let's say we use an AED, shock them back. Then we have to find the root of the problem. Once they're breathing, we want to make sure that it's not abnormal breathing. We want to make sure it's normal breathing. We want to check their pulses. So yeah, now when we check their head, we do a chunk check. Chunk check. Make sure that they're breathing all right. And so after, all right. So now we are on to the next phase, which is the initial. So this is a little more in depth. Obviously, the secondary is the most in depth, but for this, we're gonna check their head. We're looking for any contusions, any lacerations in their head. We want to make sure their head's okay. And then we check their neck. So for that, we want to make sure that for their neck, nothing is like abnormal, whether like their throat's out of place, or like their esophagus, or that there's any lacerations or anything to the neck, any cuts, any bleeding, blood loss anywhere. We're always checking for blood loss. And then we're checking the airway as well, for that, yeah. And then so nextly, we'll do a little pain test in the trap once they're conscious. Then we just go down and we check their hips. We always push in, never down, because if you push down, it could interfere with other any muscles or any bloodlines. And then we check their pulses on their feet. We check them on their wrists too. And we check them on the neck as well. Those are 3 distal pulses. Okay, so next, I forgot to mention part of the scene, like size up, is like, or just make sure the scene is secure, is like the weather too. Like that could depend on like, the situation. In this case, we're indoors, so it's not an issue. Okay, so nextly we have secondary assessment. So for the secondary assessment, we're really looking at, what's our guy? We're gonna try to find the root of the problem. So for that, what we need to do is we need to check every little thing. We're starting with the head. We're really gonna in-depthly check the head. We're gonna check for any contusions, any the raccoon spot, I believe is what they call it, behind the throat, the ear. Make sure that that means there's no bruising. Pretty self-explanatory. And then after that, we're checking neck, again, breathing, airway, everything, head to toe. We're checking the pain test. We're checking shoulders up and down, move them around. We're checking pat down the arms, make sure. We're checking their hands, their wrists, can they move their hands? And then we're going down, we're checking the chest, and we're doing the pulse every 5 minutes if they're in critical condition, 10 if they're unstable. And so we're checking the chest. We're making sure it's rising normally, not abnormally. We're looking for any wheezing or any difficulty there. We're also checking if they can communicate with us, so that'll help us. So as we continue down here, we're checking the hips again. Obviously we did both arms, checking the hips, in, not down. We continue. patting down the legs, making sure there's no discomfort anywhere. Then we get to the feet, and we just want to make sure that they can feel their toes like that. Yeah, so also with the chest, we're looking for like any palpations, you know, any discomfort anywhere. Yeah, and so after that, we are looking at our guy here. Probably gonna do a reassessment here. We want to make sure that you know, for the head, there's no contusions, abrasions, anything like that. We want to find out where the pain is. And so after this, for the reassessment, we're going to do all those steps again. Check head, check arms, legs,